Lesson 1. What are aesthetic treatments? Hi, and welcome to Lesson 1. In this lesson, we're answering a very important question. What exactly are aesthetic treatments? Aesthetic treatments are professional services designed to improve the appearance, condition, and overall health of the skin and other visible features. Depending on the treatment, they may help with concerns such as acne, dryness, sensitivity, uneven tone, rough texture, congestion, fine lines, loss of firmness, scarring, unwanted signs of environmental and sun-related damage. Some aesthetic treatments work mainly on the surface of the skin. Others work within the deeper layers to support processes such as cellular renewal, hydration, circulation, controlled exfoliation, or collagen production. But aesthetic care is not about making everyone look the same or trying to erase every natural feature. Healthy skin can still have pores, texture, freckles, lines, movement, and scars. The goal of thoughtful aesthetic care is to support your skin, improve the concerns that matter to you, and help you feel more confident while still looking like yourself. Aesthetic treatments are also more than basic beauty services. A professional treatment usually begins with a consultation and skin assessment. Your provider may ask questions about your goals, health history, medications, current skincare products, lifestyle, previous treatments, and any sensitivities or reactions you may have experienced in the past. And I know that seems a bit excessive, but trust me, there's a reason for each and every question that's asked during the consultation. From there, the services may include professional products, tools, devices, techniques, and specific preparation or aftercare instructions. Aesthetic treatments may be corrective, preventative, restorative, relaxing, or a combination of all four. Some treatments create an immediate visible improvement. For example, your skin may look brighter or feel smoother right after the appointment. Other treatments work gradually and may require several sessions before meaningful changes become visible. There are many categories of aesthetic treatments. These can include customized facials, enzyme treatments, chemical peels, dermaplaning, microdermabrasion, hydrodermabrasion, microneedling, nanoneedling, light-based therapies, microcurrent, radiofrequency, waxing, lash and brow services, and many others. Each treatment works differently and has its own benefits, limitations, contraindications, preparation, requirements, and aftercare, which is one reason why I created this for you, because each treatment is so individual that it's hard to educate the client on each and every one of these treatments while we're in the treatment room. So I created this course so that you're able to do it at your leisure and learn what it is you need to know about each treatment. That is why a treatment that works beautifully for one person may not be appropriate for someone else, even if they have or appear to have the same concerns. You may also hear terms such as cosmetic aesthetics, medical aesthetics, and holistic aesthetics. Cosmetic aesthetic treatments generally focus on improving visible concerns and supporting the condition and appearance of the skin. Medical aesthetic treatments may include stronger procedures, prescription products, injections, lasers, or services that must be performed by or under the supervision of an appropriately licensed medical professional. Holistic aesthetic care considers the skin as part of the whole person, or holistically. It recognizes that stress, sleep, hydration, nutrition, habits, environment, products, and overall wellness can influence the skin, how it looks, and its functions. These approaches can overlap, but the provider's training, license, scope of practice, and the type of procedure determine what can legally and safely be performed. Different treatments also work through different mechanisms. Some remove accumulated surface cells, some support hydration and the skin barrier, some calm visible irritation, and others create carefully controlled response that encourages the skin's natural repair and renewal processes. The key word is controlled. Professional treatments should be selected according to your skin's condition, your health history, your tolerance, and your ability to follow the required aftercare. More aggressive does not automatically mean more effective. The strongest treatment is not always the best treatment. The right treatment is the one that safely addresses your needs without creating any unnecessary risk or injury. Your results will also depend on the treatment itself. They may be affected by your current skin condition, the concern that's being treated, your age, natural healing process, medications, lifestyle, sun exposure, home care routine, and how closely you follow your preparation and aftercare instructions. Professional treatments and home care work best when they support each other. A treatment alone cannot permanently compensate for repeated sun exposure and unsuitable routine, inconsistent sunscreen use, or repeatedly damaging the skin barrier. You are also an active participant in the treatment process. Your responsibility is to provide complete and honest information, ask questions, follow instructions, and contact your provider if you experience any unexpected reaction. You should never assume a treatment is safe for you simply because someone else had a positive experience with it. The most important takeaway from this lesson is that aesthetic treatments are professional services designed to support and improve the appearance and condition of the skin through carefully selected products, techniques, devices, treatment protocols. The best results come from choosing the right treatment, not simply the newest, strongest, or most popular or trending treatment. In the next lessons, we'll discuss why a consultation is so important, how your provider selects the appropriate treatment, and how to plan for your appointment around preparation, downtime, and aftercare. Thank you, and you have now completed Lesson 1, and I will see you in the next lesson.